And then we moved on to the knee and the ankle. Now, chronically, this patient's right hip has always been a problem. And when she goes and sees her chiropractor, her myopractor, her massage therapist, whoever she sees, she always has different kinetic chain aspects on this right side, where that right arch is going to drop a lot more than her left side. Her right knee is then going to have more valgus stress, and so it's going to be a little knock kneed on that right side, and all of that is contributing to a lot of tension that she ends up getting in her actual hip, right? And so we've treated the hip twice. We didn't need to treat it this time, but we've treated the hip twice in the past with PRP. She was doing absolutely phenomenal with that. But now she's kind of getting this right foot pain that's actually at the base of the navicular, which is that kind of on the inside arch of your foot is one of the bones there, which a lot of people can be tender with it. But because I think we have improved the integrity in the hip, she's now starting to feel that load a little bit more in the other areas of that kinetic chain. So if you buy into the Thomas Myers myofascial meridians ideas, which I 100,000% do, we assume, we think that there is force transmission lines through the body that are coming from one area and going to the other area, which allows our bodies to actually move more efficiently through space. What happens sometimes, though, is that because those myofascial force transmission lines, we can have weakness in particular areas, and then one specific spot is going to take the brunt of that weakness. And so for her, it was actually her hip. So along the myofascial meridian that we were treating, her hip ended up taking the brunt of it. Now we got the hip better, and so what started to show up was actually a little bit of instability in the knee, as well as some pain on the navicular, on the top side, and then also on the arch side. So after our exam, that takes into consideration these myofascial meridians, these myofascial force lines. What we ended up finding was that obviously she had some pain along the actual navicular. She had weakness of tib anterior, which that weakness ended up translating to some instability in the proximal tibiofibular joint, which there's a very close connection with those structures there. And then also some issues with her IT band, and then the LCL ligament, which all of those can be part of these myofascial meridians and the force transmission lines. And so in order to give a comprehensive treatment for her today, we treated that navicular. We also then treated the patellar tendon. We treated the LCL. We treated Gertie's tubercle, which is where the iliotibial band attaches. And then also the proximal tibiofibular ligament, which again holds so here's your fibula, here's your tibia, this is your shin bone, this is the little shin bone on the outside. That tibiofibular ligament helps to keep these things approximated well. And so that was our approach, and it's something that we frequently do here at Regenerative Performance, which is take a step back and actually look at what are some of the things that are contributing to this patient having pain in this area. So that way, in conjunction with physical therapy, in conjunction with body work, in conjunction with the mobility exercises that we've prescribed her, in conjunction with everything else she is doing for her health with her other physicians, both here and elsewhere, how can we help this patient to truly heal and not just temporarily make the pain better, even with the PRP injection, for it to just come back in 2 years because the underlying issues were not fully addressed. So that was our day. That was Friday. I hope you guys enjoyed this week. Like, subscribe, do all the good things, and I'll see you later.